Hi everyone, my name is Jennifer Meals and today I'm presenting on Duchenne's muscular dystrophy. So just an overall description of the disorder, it's a genetic disorder characterized by muscle degeneration and weakness. Symptoms include voluntary muscles being affected, so the first to be affected are things like your hips and your pelvic area, and then slowly it goes to your legs and then your upper body. A lot of symptoms include fatigue, which is tiredness, falling because they don't have the strength to walk. Sometimes at young ages it starts as like an awkward manner when they're walking or a strange gait. They usually have a lack of motor function. And then they have a higher risk of neurobehavior disorders such as ADHD and things like that. So this disorder occurs normally at age 6 in males. Most are unable to walk by age 12. 1 in 5,000 males are affected each year, and life expectancy for these males tends to be 25 to 26 years old. And most of them die by respiratory failure by the time they are 26. It's not actually from not being able to walk or their muscles being atrophied. So for the mode of inheritance, so it's an X-linked recessive, so that means that it's passed down from their mom. A mutation of the dystrophin gene at locus XP21, located on the short arm of the X chromosome, is what causes it. So dystrophin connects your cytoskeleton to your basal lamina, which is what causes your muscles to be weak. So females can show symptoms, but they're not as bad because normally the female will be a carrier of the gene, but will not have it. So for diagnosis, they can either do a DNA test to check if you have this mutation on the dystrophin gene, but they do a muscle biopsy, or you can do prenatal tests and get gene therapy to see if your child will have it. So some treatments. So there's currently no cure for Duchenne's muscular dystrophy. They basically try and work on controlling the symptoms, which can be a little tricky. So basically, potential treatments include physical therapy. So like this picture I have here, this child who you can clearly see has a brace on his shins and ankles, is trying to walk up the stairs, and a lot of things like this is really all you can do to try and prevent their muscles from atrophying. So, and then they also need respiration assistance sometimes. So basically, they'll be connected to a ventilator to help breathe. And then corticosteroids to help muscle strength. So these are only working for 2 years, and basically they can help provide some strength to the muscles, but they only work for 2 years, so it's not a long-term treatment. Swimming is also really helpful to these patients because it's not a super exhaustive exercise. So basically you're in the water, you're not as heavy as you would be on land, and you can be walking on a treadmill under the water, and it just makes things a lot easier for the patient. And then braces and wheelchairs, obviously, as soon as they show signs of not walking, they'll probably put braces on them to see if they can help strengthen their shin muscles and those things, and your ankles, because they want to try and keep these patients from walking as much as possible before they can't. And then once they can't walk, they will be put in wheelchairs, and normally they have motor functions of their hands, so it's easy for them to use an electric wheelchair and go around like that. So some current research about the disorder. So they're trying to figure out some gene therapy. So inserting new dystrophin genes to possibly fix the problem. So this directly relates back to our class because we talked a lot about gene therapy and how it can cure things like this. And then they've also looked into exon skipping, so using AONs to ignore certain parts of genetic instructions. And then the significance of this disease for me. So I tore my ACL my junior year of college, which caused a lot of atrophy to my right leg. It was really clear that there was a big difference in what my left leg muscles were versus my right leg because I couldn't really walk on it or put any pressure on it. So at this time in my life, I felt so weak, and patients with this disorder feel like that all the time. So, and then also when I was in grade school, I noticed a kid who acted like this, and he had the braces on his shins. He eventually was in a wheelchair. I don't know where he is right now in life, but I think taking the steps to research and volunteer to help people with this disorder would be amazing. And here are my sources.